The rotator cuff is a group of muscles around the shoulder. It helps us move the shoulder over our head and move it inside and outside. It also helps stabilize our shoulder and keep it in place. It can be a number of different things. A lot of times it's just degenerative injuries over time. It can also be a fall that happens directly onto the shoulder. Sometimes people will tear it when they're lifting something heavy, particularly overhead. Things like smoking, family history will also increase your risk of tears. You'll typically have quite a bit of shoulder discomfort, again, overhead. Two of the most common symptoms would be pain on the outside of the arm and then pain at night. Typically you would come into our office and eventually, if you weren't getting better with conservative treatment, we would have to get an MRI to confirm it. So initially we always try to treat things non-operatively, so that's going to be physical therapy, anti-inflammatories, and injections. If you do have a full tear, you're typically going to need surgery. And surgery is going to be an arthroscopy, which is small incisions around the shoulder where we can put a camera in the shoulder and use some other small incisions in order to fix the rotator cuff. The rotator cuff cannot heal without surgery. Unfortunately, the body cannot bridge the gap when the tendon tears away from the bone. So this is probably the hardest thing about the whole process, is it does take a very long time. I would say average recovery is probably about 8 months, but a lot of people will tell you it takes about a year to feel normal.